Hi everyone, today I'm going to talk about acute glomerulonephritis, also called AGN. I'll explain what it is, what causes it, symptoms, how it's treated, and how it affects patients and their family. Acute glomerulonephritis is a disease that causes an inflammation in the kidney. Inside the kidney, there are tiny filters called the glomeruli, and their job is to clean our blood by removing waste and extra fluid. When these filters become inflamed, they can't do their job properly. The most common cause is untreated strep throat or skin infection. What surprises me is that the bacteria don't actually cause the damage to the kidney. Instead, our immune system reacts to the infection, and that reaction ends up causing the kidney inflammation. Biological mechanism. So here is how the disease happened. After the infection, the immune system makes an antibody to fight the bacteria. Those antibodies stick to the bacteria and form something called immune complex. Some of those immune complex get trapped in the kidney filter. That causes an inflammation and damages the filter. Because they're damaged, blood and protein can leak into the urine while waste and extra fluid stays in the body. That's why most people develop swelling, high blood pressure. Signs and symptoms. Some common symptoms are swelling around the eye, the face, ankle, feet, the presence of blood in urine, less urine than normal, fever, fatigue, loss of appetite, pain in the side of the body. And treatment is mainly focused on helping the kidney recover while controlling symptoms. So doctor may prescribe medication to lower fever and remove extra fluid. Patients are also asked to limit salt and fluid so that they don't overwork their kidney. And if the infection is still there, antibiotics are used to treat it. This disease can affect anyone, but it's most common in children and older adults. In 2021, there were over 528 new cases around the world. The good news is that many people recover completely, especially when the disease is diagnosed and treated early. One part of my research that I found really interesting was learning about the complement system. It's part of our immune system and normally helps fight infection. But in this disease, it can become overreactive and cause even more damage to the kidney. Because of this, scientists are developing new medicines called the complement inhibitors. They are also working on better test and diagnose to diagnose the disease earlier and more personalized treatments for patients. Social impact. This disease doesn't just affect the kidney, it can also affect the person's daily life. Children may miss school or sport because they're tired or have a doctor's appointment. Parent may have to miss work to care for their children's, and medical bill can create financial stress. Some families also have trouble finding kidney specialists, especially if they live in rural areas. So these are the sources I use to create my presentations. Overall, this project helped me understand not only how the disease affects the kidney, but also how researchers are working to develop better treatments. And this concludes my presentation. Thank you for listening.